I'm Dr. Seger, and I'm going to demonstrate a fluoroscopic or X-ray guided fill of a laparoscopic adjustable gastric band. We have our patient, our fluoroscopy machine, and our syringe with a three-way stopcock and a needle. So here we go. First, we're going to make a picture of the port, and then we're going to use the X-ray to place the needle directly into the port, thus causing minimal discomfort to our patient. So you'll feel a little stick here, and then the needle will access the port. Now, when most patients get their band fills, they don't have the benefit of using X-ray, and so sometimes the doctors can have a lot of chances to try to poke that, and it sometimes hurts. But with our patients, we're usually able to make the access very quickly. The second step is taking a picture of the band itself. And once we do that, then we'll be able to do the adjustment. The adjustments are made based on the patient's needs. Again, when you don't use the fluoroscopy, the patients are given adjustments based on a cookbook of what they might need based on how far out from surgery they are. So when we use the X-ray, we're able to make a tailored or a personalized adjustment for each patient. So let's take a drink and see what your band looks like before any adjusting. On the screen, you can see the contrast coming down the esophagus and through the band channel quite easily. There's very little restriction there. So we are going to add some fluid to this band. I'm going to put in 2 cc's, which is probably a little bit more than we need, and then we'll be able to back off after that. So take another drink. Here's our contrast again, passing down the esophagus to the very top of the band, and it's having a little trouble getting through there. You might even see it reflux back a little bit. So that represents an overfill or too tight of a fill. And we're going to back off while we're watching on the screen and watch it come through. So I'm going to take out a half cc, 1 cc, and then do a dry swallow for me, and we'll see what that looks like. And then take a little bit more from the cup. And here it comes down the esophagus now towards the channel. Very slow, but nonetheless it is emptying. And a little tiny bit of reflux. I would suggest that may be a little bit too snug, but we're very close. So I'm going to pull back another 1/4 cc, and we're going to stop there and then take one more drink for me. And this should be a perfect adjustment for you. Again, we're able to put the exact amount that you need based on what we're seeing here on the film. So here comes what you drink, and then it is moving through your band channel slowly but surely. Take one more big drink for me. Is there any more of that left? So there it is, coming down. And there it is passing through. And you see how you didn't reflux, but it was very slow how it went through. That's exactly what we're looking for with a perfect adjustment. So that was 0.75 cc's that we added. You'll feel a little pressure as we pull that out, but it shouldn't be too bad. Okay? And that's all there is to it. So remember, you must be on liquids for 48 hours, and you can start eating again. You might also find that you're not able to eat solid food in the morning because band patients always feel a little more swollen in the morning after we do the fill especially. You know, breakfast is usually going to be liquid once we get it to where we need it to be.